Well, moving on, India's fresh coronavirus infections rose by 45,882 new cases in the last 24 hours. India has now crossed the 90 lakh mark. Government data also shows that India has crossed 9 million cases or 90 lakh cases. Recoveries, however, have surged past the 84 lakh mark, pushing the national recovery rate to 93.6%. Now, 584 people have also died since Thursday. The overall number of deaths being reported in India has crossed the 1.32 lakh mark. Now, here's a significant development, and Akshay joins us with the very latest. The centre has already, Akshay, dispatched teams to 4 states to take stock of the Covid-19 situation. What you're now telling us is that the centre may deploy teams in many more states to deal with the Covid-19 crisis. It's contemplating states and union territories, and the focus really is going to be to increase testing. Is that correct?
Well, exactly, Rishika, because testing has been a problem as far as the entire country is concerned, and despite the testing has been increased, most of the tests have been the less reliable rapid antigen test, and that has been a point of worry because in many states, for example, when we are talking about Telangana, there are reports that approximately 80 to 90% of the total tests are the less reliable rapid antigen test, and even though they are giving out a positivity figure, the false negative is as high as 50%. No? So that's one concern for the health experts as well as for the government, because what the government at this point in time is saying is that many of the cases are being undetected, they are being unreported, and the patients are there spreading out the virus. So that is one concern. Earlier, as we have seen that to 4 states including Gujarat, Manipur, Rajasthan and Haryana, teams have been sent including healthcare experts from the national capital and other parts of the country to these states. But now the centre is contemplating to check, to surveillance, to trace and detect all the cases that are there in other states as well. Well, for example, when we are talking about Bihar has been a point of concern for the health ministry, because earlier when there was a press conference by the health ministry, they clearly stated that they still haven't taken into account the problem that will be caused due to the election that has happened in the state of Bihar and other states as well where bypolls have happened. So that they will have to take that into consideration only after an analysis, and that exactly is the reason that teams will have to be sent there to get a real picture of what is happening on the ground.
All right. So clearly the centre there to deploy more teams to get a realistic understanding of what's happening on the ground. Remember, testing is key to tracing and treatment. So that's going to be the focus as far as the centre is concerned. But Akshay, the worrying story, of course, is Delhi at the moment. The total deaths in Delhi have crossed the 8,000 mark. There are 98 new deaths that have been reported. So clearly there is a spike as far as the number of deaths is concerned. They've also now once again been over 7,500 new cases in the last 24 hours. So Akshay, there's a house-to-house survey and there's that 2,000 rupee fine for not wearing a mask. Is it working?
Well, we'll have to see in coming days that how exactly the fine is going to impact as far as the reality on the ground is concerned, because many a times what happens is that when people are in car, they believe that they do not need to wear a mask. But we have seen that many people have been fined for not wearing a mask even though they have been a single person in the car. The government is right on their part stating that a car on the road is a public space, and whenever you come out of your homes, you have to wear a mask. That is mandatory. Earlier, people were taking all of these rules for granted, but now the fine has been increased to many-fold. The second part here, and that's very important, is the surveillance, because even the Delhi government earlier has been stating that surveillance will be very, very important in tracing and detecting all the cases and then treating afterwards. And now earlier when we saw there was a meeting between the Delhi Chief Minister and the Union Home Minister, one point that was very crucial was surveillance in all of houses in the national capital, including teams from medical experts from AIIMS, MCD officials and officials from the Delhi government to trace and detect all of these cases. But yes, the number of deaths have increased with the onset of winters and with the pollution. We have seen that the experts have been warning that the cases might even go up.